welcome back to Beauty Doctors by Kakuna. I am Dr. Sanjay, your host for today. We're going to have a very serious discussion today on breast enhancement or breast augmentation. Whenever we talk about plastic surgery, obviously breast enhancement comes into conversation, and celebrities like Pamela Anderson, Kim Kardashian will also pop up in our mind. Critics may say, why do you need to do this? Let the body be as it is. But we as plastic surgeons and many millions of women who have undergone this procedure would believe differently. But the point is, one must know what the problem they have. What are the solutions for that? Are the solutions safe? Are there any side effects to the body? But you need to discuss with the specialist. And that's why I have a specialist here today who specialized in breast surgery. He is a German board qualified plastic surgeon, and he is director of Aestheticon, which is based in UAE, in Dubai, in JLT. Dr. Afschin Ghofrani. Welcome, Dr. Afschin. Thank you very much for coming in.
Thank you very much, Dr. Sanjay, for the invitation. I'm thrilled to be here.
Thank you. I would like you to first introduce yourself. Tell us about your training and your experience so far.
Yes, I'll gladly do that. I was born and raised in Germany, and I went through high school and studied in Aachen, which is near Cologne. Finished my medical study there and worked at the university hospital for a few years, where I covered reconstructive surgery, burns, trauma treatment, microsurgery, etc. Then I moved on to Cologne, where I studied mainly aesthetic procedures of face and body. And then finally, for 8 years, I was heading a hospital department in Gießen near Frankfurt. And in 2010, I moved then to Dubai and launched my clinic Aestheticon.
Wow, that's a long journey.
Yeah.
And this is, what is required, the experience, the training, And I'm going to have a lot of questions for Dr. Afschin, and I'll like to pick his brain on a few things. First of all, let me know who you think are the best candidates for breast enlargement or implant or enhancement.
The best candidates are those who think they need it, and we also think they need it. That would be the ideal candidate. So women who have, when they look at their body, they feel there is an imbalance. When they look at their frame, they feel the hips related to the chest is not in balance, the chest is too small. And these are the ideal candidates to enhance it and bring it to a natural balance of the body parts, which basically is the ultimate goal of plastic surgery, to restore a balance and symmetry, because that is beauty.
It's very interesting, and let me give you an example. Many times we come across people come to us, the women, and they always say they want a very natural looking breast. You have a discussion, you have a consultation, an hour, you explain to them pros and cons. Then you have a second consultation after a few weeks. And they come up, they said, doctor, since I'm going through it, I would prefer a bit bigger implant, because my partner, my husband also feels that if you're going through it, why not do it bigger? Then they come back a third time where they want to try different sizes, and then they go for even bigger. So what's your opinion on the size of the implant, and how would you choose that?
That's a very interesting, very important, and also a very difficult question, because it depends purely on the patient. There are patients like those that you just described. I see them too. And there is the opposite also. Patients who say, I want an enlargement, but I don't want it to look fake, so I don't want it to be too big. So you have to really convince them to go a little bigger, because I'm sure you agree that on the long run, there are very few patients who consider their breasts too big after implantation. Right. But some of them may say, gosh, I wished I had gone a little bigger like you advised me. So yes, that's a difficult question, and I think we as plastic surgeons, it's not necessarily our role to convince them of our opinion, but to show them just the boundaries. What's the minimum we would suggest and what's the maximum we would suggest? And obviously this range is different from plastic surgeon to plastic surgeon and the experience they have. But the way I handle it is, in my mind, when I see a patient, and after so many years, we know quickly what would fit. There is a range that I'm comfortable with, and then ideally the patient fits into that range, and then you can go ahead.
But what do you think the consequence of a larger implant is? Maybe for a person, maybe a 400cc is not large, but yet for another person 400 may be a bit too big. What do you think are the consequences of going for a bigger implant in a particular body frame?
Yes. So let's say if you talk about a patient where 400 would be too big and they would still insist, the reason why we think it's too big is because their chest is too narrow and maybe the skin envelope, the quality of the skin envelope is not good enough. And we already can foresee that the pure weight of the implant will cause problems in the future. Sagginess, stretch marks on the skin, etc., etc., back pain for that matter. So sometimes it's better to go a little smaller than the patient may want because we can foresee the problems that occur. Otherwise, you may have a patient who is very solidly built with an extremely well-built skin, thick collagen thickness, which can easily fit in larger implants, and also we can judge that and then agree with going for a bigger implant.
But whenever we talk about breast implant, we also consider reoperation rate. We don't want them to have procedures again and again. And obviously there are two things. One is the changes in the breast that may occur over a period of time. And the second thing is the recommendation by the implant companies for the safety of the implant.
Yes.
So what's your opinion about reoperation? Why would one need reoperation?
So in general, the only long-term complication of an implant is the capsular contracture. Other than that, everything else is extremely rare. When we talk about capsular contracture with the modern implants we have, and in the hands of experienced surgeons like yourself and me, the capsular contracture rate is something between 1 to 4%. If you look overall, over all plastic surgeons, includes the very young ones, those who just started their journey, it's above 10%. So when you consider, let's say, 1 to 2% capsular contracture rate, if you look at it positively, it's 98 to 99% won't have a problem, which is a completely different message then, right? So all in all, carrying an implant regarding long-term complications is quite safe. You may need a revision if you put the implants in at a very young age because the tissue will change. You cannot avoid it. So if the tissue changes after 20 years, the breasts drop over the implant, you may want to reshape the breast. And if you do it after 15, 20 years, obviously you would also replace it with a newer implant. Other than that, there is a very rare disease, we may talk about this, which is a kind of lymphoma. It's called ALCL. It has come up in the last decade in the literature. It's a very, very rare disease which is associated to the rough surface implants. Right now, worldwide, there is more observation and collecting of data, but we plastic surgeons have already reacted to that because safety is the first for us. So data shows that smoother implants or the microtextured seem to be safe. So this is why most of plastic surgeons are shifting to this kind of surface. I think you agree with that.
I do agree with you, totally. Tell us the difference, tell our audience the difference between the smooth implant, the nano-textured and the macro-textured implants.
Yeah. So the smooth implants, we can see it on the table, it looks like this. So it's an absolute smooth surface. This basically were the first types of implants that were introduced worldwide in the 60s. The smooth implants have one disadvantage. They have a higher capsular contracture rate. So with smooth implants, it can go up to 30% of the cases. And this is why smooth implants at some point in the late 70s, 80s, if I'm not mistaken, maybe a little later, were replaced by the rough surface, because the rough surface data shows that the capsular contracture rate was much lower. And the rough surface in Europe was standard for decades. In US, a little differently, there was a dip of rough after some kind of turmoil with the company who was producing it, Dow Corning. So they went back to the smooth ones, but in Europe it was never an issue. They were always using the rough surface. And then with all these discussions about ALCL and also with the aim to improve the capsular contracture rate, the companies came up with a new surface, which is the nano-textured, or a little bit rougher at that, the micro-textured, which would look like this. This is basically a middle thing between the smooth one and the rough ones. And these right now seems to be promising because the capsular contracture rate is very low and there is no association with any diseases that we're discussing.